Imagine this. Your elderly parent or grandparent has just suffered a massive stroke. They can no longer move one side of their body. They can't speak. They can't respond in any way that makes sense. You're sitting in a hospital room listening as the medical team talks about life support, feeding tubes, and breathing assistance. In that moment, a question begins to form in your mind, one that feels almost impossible to say out loud. Why are we doing this? Why are doctors working so hard to keep my loved one alive when it looks like they will never recover? If you've ever wondered about this, you're not alone. Today, we're going to talk honestly and compassionately about why doctors intervene to sustain life after a devastating stroke, even when the odds of full recovery are very low. We'll explore the medical reasoning, the ethical principles, the legal responsibilities, and the human emotions that guide these decisions. By the end, you'll have a deeper understanding of the why behind one of the hardest experiences any family can face. What happens during a severe stroke? Let's start with what actually happens in the body when someone suffers a major stroke. A stroke is a sudden interruption of blood flow to part of the brain. When the brain doesn't get oxygen and nutrients, cells begin to die within minutes. There are two main types of stroke. Ischemic stroke caused by a clot blocking a blood vessel. Hemorrhagic stroke caused by bleeding into the brain. In severe strokes, a large area of the brain is damaged. Swelling and pressure build up. Vital brain centers controlling movement, speech, swallowing, and consciousness are affected. This is why you might see complete paralysis on one side, loss of speech, aphasia, and profound confusion or unresponsiveness. It's devastating. And the reality is, some of the damage is permanent.
Why doctors act quickly to intervene?
So why do doctors rush to save a life when the outlook seems hopeless? There are several reasons, and each is important to understand. Reason number 1, the golden window of uncertainty. In the first hours and days after a massive stroke, it's often impossible to predict exactly how much function will return. The brain has remarkable plasticity, the ability to rewire itself. Even in elderly patients, some people regain more function than anyone expected. That's why the initial approach is almost always to stabilize, preserve life, and buy time. Reason number 2, the ethical duty to preserve life. Physicians take an oath to do everything reasonably possible to protect and prolong life. When a patient is unable to communicate their wishes, doctors act under the assumption that most people would want to be given a chance, at least initially. This is called the presumption in favor of life. Reason number 3, time for families to understand and decide. Severe stroke creates a tidal wave of shock, grief, and confusion. Families often need days or even weeks to process what has happened, understand the prognosis, reflect on their loved one's values and wishes. By intervening to sustain life, doctors create space for these critical conversations, rather than forcing families to make rush decisions in the first hours of crisis. Reason number 4, legal responsibilities. In many countries, including the United States, doctors are legally obligated to provide stabilizing care unless there is a clear advance directive refusing life support. A legally appointed decision-maker requests withdrawal of treatment. Continuing treatment would be considered medically futile. Until those criteria are met, the default is to attempt life-saving measures.
What medical interventions are common after a severe stroke?
When you see a loved one in intensive care, attached to tubes and monitors, it can feel overwhelming. Here's what doctors may do and why. Airway and breathing support. If stroke affects consciousness or swallowing, patients may need a breathing tube or ventilator to keep the airway clear. Feeding tubes. A nasogastric tube provides nutrition if swallowing is unsafe. For fluids and medications, these help maintain hydration, blood pressure, and prevent further strokes. Monitoring and control of brain swelling. Severe swelling can be life-threatening. Doctors use medications and sometimes surgery to relieve pressure. Prevention of complications. This includes preventing pneumonia, blood clots, infections, and bed sores. These interventions are not necessarily permanent. In many cases, they are used temporarily to stabilize the patient and allow time for assessment.
Understanding prognosis, why it takes time to know.
One of the most challenging realities of stroke care is that the true outcome often isn't clear in the first few days. Early brain imaging shows the area of damage but doesn't always predict how much function can be recovered. Swelling peaks around 48 to 72 hours, sometimes worsening symptoms temporarily. Neurological assessments can be limited by sedation and swelling. Age and pre-existing health can affect recovery. This uncertainty is why doctors often say, "We need time to see how your loved one responds."
When continuing treatment may be considered medically futile.
Over time, if there is no meaningful improvement, the team will start discussing whether continuing aggressive treatment aligns with your loved one's values. Treatment may be considered futile if there is no capacity to breathe independently. There is no response to pain or stimuli over an extended period. There is no possibility of regaining consciousness or awareness. At this point, the focus often shifts to comfort care.
The role of palliative and hospice care.
When a stroke has caused irreversible damage, palliative care teams help families transition from life-prolonging interventions to comfort-focused care. This doesn't mean giving up. It means managing pain and discomfort, supporting emotional and spiritual needs, allowing a natural end of life with dignity.
Talking with doctors about goals of care.
If you're unsure why interventions are happening or whether they should continue, it's okay to ask. Here are some questions you can bring to the medical team. What is the prognosis for recovery? What are the chances of regaining awareness or function? What treatments are we using to sustain life right now? What will happen if we stop these treatments? How do we ensure comfort and dignity? These conversations can feel overwhelming, but they are essential.
When advance directives are in place.
An advance directive is a legal document that states a person's wishes about medical treatment if they can't speak for themselves. If your loved one has a living will declining life support, a do not resuscitate, DNR order, a designated healthcare proxy, doctors are legally and ethically bound to honor these instructions. If no advance directive exists, decisions fall to the next of kin or appointed surrogate.
The emotional weight of these decisions.
You may feel guilt about prolonging suffering, fear of making the wrong choice, pressure from family members who disagree, grief over the person you knew. These feelings are normal. Remember, you did not cause the stroke. You are acting out of love and respect. There are no perfect answers, only the best decisions you can make with the information you have.
Finding support and hope.
Even in the hardest moments, you are not alone. Hospital social workers and chaplains can provide guidance. Support groups help connect with others who understand. Counseling can help you process guilt and grief. Palliative care teams can guide you through decisions. Over time, many families find peace in knowing they acted with compassion and courage.
A final word of encouragement.
If you take away one thing, let it be this. Doctors intervene after severe stroke because there is always a window of possibility, however small, for recovery. They also act to give families time to understand what has happened, make thoughtful, informed choices, ensure that if life must end, it ends peacefully and with dignity. This is not about prolonging suffering for its own sake. It is about honoring life, respecting wishes, and allowing love to guide decisions. You are stronger than you know. You are doing your best. And you are not alone. If this video brought you clarity or comfort, please subscribe to our channel for more guides on stroke care, caregiving, and end-of-life planning. And if you know someone facing these decisions, share this video with them. Sometimes understanding the why behind medical care can ease the burden of uncertainty. Thank you for watching. Stay informed. Stay compassionate. And remember, every step you take is an act of love.